So welcome back, everyone. In this episode of Joint School, we will be revisiting Sonny, who's, I'm delighted to have you back, Sonny. Now 6-7 months after his hip replacement. And for those who haven't seen already, there's an excellent 2 videos where Sonny kindly shared his thoughts before having a same-day hip replacement, and then sort of looking back on the early weeks of recovery. And so today we'll be checking in again with Sonny and seeing how things are now at sort of just gone on from the 6-month mark after a left-sided hip replacement.
Thank you, Axel. Glad to be back and record our 3rd video together. Yeah, it's been 6.5 months now, to be exact, coming up to nearly 7 months. So it's an interesting time to just recap on where we are on the process, really.
Yeah, absolutely, and I think one of the main questions that people watching this will be, who are in the earlier stages of their own journey, getting ready for hip replacement, or perhaps in the early weeks, those early weeks of recovery right now. I guess one of the main questions, the first one perhaps to talk about, is pain. How is it now, and looking back, how's it been?
Yeah, so the pain has subsided greatly, and it will do. And I think anyone that's preparing for a hip replacement, always in those early stages, look, I think when you're about to have your hip replacement, obviously there's a lot of nervousness around the pain management, etc., and how your body's going to be able to cope. And what I found is actually the body is more resilient than we give it credit for, and it's more adaptable. I'm not going to lie, yeah, the first couple of weeks were very, very, very painful, and people going through that period now probably experiencing the same. Spent a good bit of time on the crutches or the walker, etc. And what you'll find is actually the pain, the pain or coming off the pain threshold is not linear; it's more exponential. So the first couple of weeks are going to be painful, and you've got to expect that. You've had major surgery; it's not a small surgery, and to get to that actual hip joint, there's about 5 or 6 muscles. I mean, but I think there's about 5 or 6 key muscles that get cut through to get to the actual joint, and you've got to think all those are being stitched together and healing together over time. So the body has to react to that, and I think the key is effective pain management. Make sure you take your meds. Don't skimp on your meds, but keep drinking a lot of fluid and make sure you don't get constipated, etc. But to answer your question, Axel, now coming into sort of month 5 or 6, the pain is effectively eased off quite dramatically. Actually, if you talk about the joint itself, which is where the hip went in, all the muscles around there healed quite nicely. So I hardly feel any pain around that area now at all. And obviously the scar has healed quite nicely. Because the other thing that, guys, you will feel is as the scar heals, don't forget there's been quite a deep cut being made into your tissue. So as that scar heals, you will get some sort of stinging or healing as those stitches start to dissolve. But again, that will heal off as well as you get further. So to answer this now, hardly any pain on a pain rating. It's probably I'm not saying there's no pain because it's only been 6-7 months. It's probably a 2 out of 10. Whereas in those first couple of weeks, it was around about an 8 or 9 out of 10.
Right. Okay. So so it certainly seems that things are moving in the right in the right direction. And would you say how that pain has changed? Was that different from what you were expecting? If you would think back to the Sonny in our first video, in the weeks before, and then in the weeks after, what has been sort of different from what you expected?
So yeah, I think there's 3 stages. That's a good question, actually. So I think it's 3 stages. So your pre-operative state, a lot of patients are going to be like me, which is why they're having the operation. They will have loss of cartilage. They will have effectively a bone-on-bone condition where spurs are growing on either the bone, the humerus, or the socket, etc. So that pain is very kind of how do I describe it? Arthritic. It's a bone-on-bone pain. So it's a bit like when you're you're bashing 2 objects together, and you hear kind of crunching noise, and the movement's very tight and very restricted, and every time you try to bend, there's a clicking or a cracking noise, and it just feels very, very uncomfortable, that kind of pain. So it's not muscular pain, it's more a deep penetrating bone type pain,
Yeah.
where your bones are hurting, Then when you have the operation, the first 2 or 3 weeks, it's bone pain completely goes, because you've now got an artificial joint and it's very fluid, but you'll have all the muscular pain, all the tight muscles and the very angry muscles, the painful muscles. So that will be a very, very deep shooting pain. As you get up and you suddenly put pressure on that leg, you'll get a shooting pain going through your thigh, and that's all your angry muscles trying to heal. And then the third stage happens where, which I'm now starting to come out of, which is sort of 3, 4, 5 months out of surgery, where everything settles down, your muscles are starting to heal, but rather than getting shooting pains, you'll get now and again, you'll get some, what I call, dull, achy, throbbing type pain.
Okay.
So it's just I've done 2 or 3 or 5,000 steps today, and I've come back and I've put the kettle on and had a cup of tea. But as I've sat down now, I can just feel that left leg. For me, it was a left leg. I can just feel that left leg and that left hip just throbbing a bit achy, a bit dull throbbing. If I could summarize it in those 3. Does that make sense?
Yeah, that does. I think that's really helpful as an overview of a sort of what sounds to me to be a fairly typical post-operative course of recovery. Now, of
Right.
course, it's important to flag that it's not always helpful to compare oneself too closely to anyone else. We're all unique and we're all going to find our own way through these things. But
That's right.
by and large, I think what you're describing is something that I've heard from many others as well, about how the type of pain that you experience changes very much, pretty much, as soon as soon as the operation is done, really. And that then there's this initial phase of healing, and then slowly but surely, as you get back to your regular activities, as the healing comes together, as you start building those muscles up again, slowly but surely you're progressing and getting back to what you want to be doing, and reaching those goals that you set before the operation.
Yeah, and I think it's important not to, to manage one's expectations of the healing process. And again, as I said, I keep repeating it, it's not linear, so it's not always progressive, linear state. So, I mean, Axel, you probably remember this from the last video, but, when I was about 2 months in or 3 months in, and recovery was going great guns, and I was starting to do more and more steps and put more body weight onto my hip, etc. And then all of a sudden I had a bit of a setback, because I started to get just a little bit of inflammation around the bursa type. So there was a bursa sac, and if I started prodding into my left hip, it was quite a painful area where the bursa sits. I'd obviously inflamed that or irritated that by just trying to do a little bit too much too soon. So that pulled my recovery back by a couple of weeks, because it was literally quite painful to even sort of walk that 1,000 steps, because that bursa was really hurting. But all I did was iced it up and just eased off the steps for a couple of weeks, and just sat around having tea and cake. And after that, hey presto, it was fine, and then I was back on my road to recovery. And now, as I said, the pain has eased off. But again, now I've got a bit of inflammation around the hip flexors, a bit of tendonitis. But I think this is important for the audience to understand that you've had quite intrusive surgery, and there's a lot of muscles that sit around that hip joint. Your gluteal muscles, your iliac area, and muscles around your hip flexors. So it's inevitable that through the operative process and the healing process, you are probably going to get a little bit of inflammation around some of those other tendons and muscles as they heal, and maybe a bit of conflict. So I'm giving you the complete picture, warts and all. So I'm 6 or 7 months in now. The hip is healing really well, but do I still get the odd inflammation of the tendon, or the odd dull pain? Of course I do. We're 6, 7 months in, but I'm expecting that anytime up to a year, maybe 18 months. Actually, I mean, how long is a piece of string, really?
Yeah. I mean, at this stage, I think it's again, it's very much in line with what other people will say. But there's a lot of research to support and show that progress can continue for quite some time. Certainly, by the 1 year mark, I'd expect, these things may well be different, and even beyond the 1 year mark.
Absolutely, absolutely. But I think the one thing, I mean, listen, everyone's different, as we said, right? So everyone's journey and recovery is different. Everyone will have different symptoms and different, senses of pain and different tolerances, I guess.
Yeah.
But I guess the one thing that's helped me is, I think the mental side is very important. We never talk much about the mental side. We always tend to talk a lot about the physical side, but I think the mental side is just as important. And I think the more positive, mentally you can keep yourself around, trying to envision the end goal of, having a full active life again, being able to do, sports, etc. I think the mind's a powerful tool. And I know it's a bit of a cheesy comment, but I've tried to keep myself positive over the last 6 or 7 months. So, not sit down and just get depressed about every twinge or every dull ache, etc. And say, you know what, just get on with it. And I know sometimes it's easier said than done, depending on what other conditions people might have, or even your age comes into it. But ease off when you need to ease off. Nobody's Superman or Superwoman, but do keep a positive mindset and trust in the process of healing, and trust that it will get better. And there'll be good days and bad days, but just on those bad days, keep a positive mindset. Treat yourself to a nice slice of Victoria sponge, and life is good. Yeah.
Hey, so I think that's a really, really important point. You mentioned earlier as well about living the experience of progress not being linear, and as you say, there being good days and bad days, and there'll be different ways of tackling that, but it's important to bear in mind and start to think about what are those things that are going to give you that extra bit of nudge of positivity. How can you link in with family and friends to get some extra support? Are you setting goals to aim for and tracking your progress towards them? Again, they'll be very individual, but it's certainly, I think, really helpful to highlight that now for those who may be earlier on in their journey, that set that expectation, and again to highlight the importance of the mental side of things, of the mind and the body.
Yeah, and the other thing that I found that's really worked for me, and again, caveat on this, everybody's different in terms of their own learning and their own healing. But the thing that's worked for me is not only the positive mindset, but guys, listen, the clinicians will do a great job, the surgeon will do a great job. There's a great team around of physios, etc. Of course, it's been a bit difficult through this pandemic to get face-to-face treatment. But one of the things that's helped me is guys, where possible, take it upon yourself to sort of self-educate yourself around what's happening to your body. I found that pretty useful for me. Now, I'm not saying, go and do a medical degree or whatever, but just, if you're feeling a bit of pain, the way that my mind works is, and there's a balance there, guys. So don't scare yourself to death by going reading in every article and think, oh my God, this is a nightmare. Just say, okay, look, I've got a bit of a twinge here. These are my symptoms.
Mm-hmm.
What could it potentially be? And it will come up with 99% of the time. It's going to be a little bit of inflammation of the tendon. It's going to be oh yeah, great. Oh, I didn't even know there was a little bursa sac sitting under my, under my hip. Maybe that's just inflamed. So the more you can educate yourself, the more you can mentally convince yourself that it's a temporary phase, and you've educated yourself that you're just going to rest up now a little bit and it will pass. And that's worked for me there. That might not work for, because I know, and I've got people in my family, the more they read and then the more they scare themselves, or the more anxious they become. So it's each their own, but it's something that's worked for me.
Yeah, no, but I guess there's a balance. But knowledge is power, but it can be difficult to find the right information, and that's perhaps something that it can be worthwhile asking your surgeon or your physiotherapist or other members of the team about where they would go to look up these kind of questions, or what they would recommend for sources of information. But and I think was really crucial as the recovery progresses. With everything going on, you've had quite a different experience of this, but meeting someone face to face, particularly in terms of physiotherapy, can really make a difference in terms of putting together an exercise plan to help guide through those different stages of recovery in a way that's takes into account all your personal factors. And
yeah, and I think that's brilliant. I think that's really sound about. I think anyone, my advice to anyone that's approaching surgery now or preparing for surgery, or has just come out of surgery and is really in those early post-operative days. I think there's a great opportunity now where, hopefully, touch wood, people are getting vaccinated on COVID, and it's been a really, really difficult year. But as facilities start to open up and physio starts to open up again face to face, if I was doing this again in hindsight and I was talking to the old self and I was in a different time and place, i.e. today, my first port of call would be my surgeon and those physiotherapists. It's just that unfortunately, fortunately I had a great opportunity to get my operation done, but unfortunately, just during COVID, the physiotherapy was not available face to face for obvious reasons. So I had to move to plan B of self-education a little bit, and try some alternative therapies. But now, anybody, I would say, basically use that as your first port of call.
Yeah, absolutely. Well, Sonny, thanks so much for your time and for sharing your experience with us.
No, pleasure, absolutely.
You've raised a number of interesting and very valid points that I think will resonate with many people who are, as we said, at these different stages of their own experience, of their own journey. And I guess we'll have to check in again next time around the 1 year mark.
No, I think 1 year is good. I mean, the final part of the thing I just wanted to quickly mention, which people might find useful, is obviously focus on your rehabilitation and therapy around the muscles, etc. But don't forget effective scar management as well. So I've been using something called biogel. I mean, you can use any type of dry skin, massage management oil or bio use, but I've felt that's really helped by just applying a little bit of that over the scar area over the last 4 or 5 months, which has just helped it to kind of ease down and heal quite nicely, actually. And it just feels quite nice if you just slowly apply that every night to the scar area as well. So the scar management and making sure that the scar doesn't get infected, etc., and keeping it clean as much as possible is just as important as the muscle healing, the tendon healing, and the mental side. So really, all those 3 things have to go hand in hand. And positive mindset, guys, and make sure you drink plenty of water and look after your nutrition and look after your health generally.
No, another really good point there, and just to flag as well with any sort of lotions or biogels or bio oils that you might be putting onto the wound and doing this sort of scar tissue massage. It's another great thing to check in with your surgeon and their team in terms of what type of, what they would recommend, but also crucially when to start doing it, because it's important that the wound is nice and dry and fully healed up before anything like that starts going on there.
Yeah, that's right. You've got to wait for it to heal before you start applying. Whilst it's healing up, just resort to good old-fashioned whiskey or something. Drinking.
Yeah, that's not for me. Whatever works.
Exactly.
Right. Well, thanks so much, Sonny. We'll see you next time. And to everyone watching this, thank you so much for tuning in. Do let us know what you think about the sessions or send in a suggestion. Keep up the good work. Look after yourselves, everyone, and stay safe out there. Thank you.
Thank you, guys.